Welcome to PRISM, our approach to collect and use patient-reported outcomes to amplify the voice of the patient and provide an avenue for patient engagement outside the clinical encounter. Our app fosters patient engagement by giving patients real-time feedback of their measure trends and where they fit in the overall population. The platform supports patient-reported outcome instruments and seamlessly integrates with EHRs. The PRISM app allows patients to quickly fill out surveys easily and conveniently. It includes friendly SMS reminders. The app provides patients and their physicians with meaningful, timely feedback, presents comparisons of how they are doing to other patients, and allows for follow-up assessments and tracking of results over time. Patients receive relevant recommendations and education to further engage them in their care. The app can be easily extended to capture other types of structured data for other patient-reported outcomes as well as supporting research. The first screen they land on gives a quick overview of what they can expect out of the experience and highlights the most important value drives to the patient based on our extensive patient interviews. They're then taken to the authentication provider where they can securely log in using their familiar Epic or Cerner account. Once this step is complete, the patient lands directly on a page describing the survey they're supposed to take and then immediately into the survey itself. We designed the survey experience to be as distraction-free as possible, but in our testing we found certain PROMIS assessment questions created confusion in a subset of patients, so we also included a help option. One of the biggest barriers to PRO adoption we identified was usability, so we created several iterations of the survey experience, testing even the specific animated transition between pages to maximize the ease of use and ultimately the patient's comfort with the application. Once a patient has completed a survey, they're immediately presented with the results. Here again, we tested many iterations with patients to visually represent the results in a way that's highly intuitive but also compelling. At this point, we suggest to the patient to download the mobile app. From our data, we found it's extremely important to offer patients the option to participate both through web or through a downloadable mobile app. Next, patients are taken to their home page where they can explore the rest of the app's current functionality. They can see at a glance trends for one or multiple types of surveys, content, and navigate to their settings. If a patient wishes to dive deeper into their data, here they can dig into their stats and receive contextual feedback based on people similar to them. Patients can also receive personalized content. We found some patients were most likely to respond to content framed as patient stories because they found it relatable, while others gravitate towards traditional health information content, so we created a system that can adapt to both. So far, we've received strong feedback from patients that the PRISM app is very easy to use even for elderly patients and ones whose level of technology comfort is low.